Went to Medical College of Georgia. I was there for 4 years. Just prior to that, I met my wife in college, and we got married 2 weeks before I started school, and we just celebrated 43 years of being married. So that's probably the best thing I got out of college, that and getting into medical school. But while I was in school, I think the first 2 years are just like accelerated college, and you don't really get a chance to get a feel for what you want to do other than get through those first 2 years. And the first rotation I had as a junior medical student, when you actually get to put on a white coat and patients might say you're a doctor, and you have to kind of correct them. I'm not a doctor yet, but it was on an OB service, and the residents took a real interest in the students. They let us do everything that we could. We got to follow patients in labor and actually deliver babies, which was, trust me, is when you've had 2 years of just been grinding along and you've just wondered if you're ever going to get there, and you finally get to do something, it's pretty exciting. And I think I was just kind of taken with the OB part. And then I found the surgery was interesting. There was enough variety, and I soon learned that I like taking care of basically well patients and seeing good outcomes. After rotating on some of the surgical services and the medical services where it seemed like, people were real sick, and a lot of times they never got better, or some of the surgery was fascinating, but it didn't appeal to me quite like OB did. And so I think I was kind of drawn from the very get-go into wanting to go into OBGYN. And I really never regretted it. I think it was having to do it all over again, I'd do it again.